The names and numbers of injectable fillers seems to be changing by the year. If you go to Europe, there are some fillers that we use in the US that I've never heard of. There are different classes. In general, the most common class of fillers that we use fall into the category of hyaluronic acids. The hyaluronic acids are made naturally by the body, but in these fillers, they are synthesized, and they come in different, what we call cross linkages, and based on how they are cross-linked will determine how long they last. So we pick and select one based on the area that we want to inject, your skin type, how thin or thick the area is, the area that we want to modify, and your experience, past experience. So we tend to individualize it. If you come to me and you have very thin skin, I may choose a filler that's really thin. The filler that I may use in the cheek will not be the same one that I will use in the lip or the eyelid area. So it's chosen based on the person's skin type, skin thickness, the location, and how long we want the fillers to last. People enter into the realm of looking for something done to their face at different times of life. If someone is working on Wall Street and wants something really quick with short recovery, they may opt for an injectable solution versus a surgical solution. If they want to see what their ultimate result with surgery would look like, they may opt for an injectable filler as a first step. Injectable fillers can be complementary to surgery, and sometimes we use one or the other, or sometimes together. In general, fillers are used to create volume or restore volume. Surgery doesn't necessarily restore volume. In the face, we're usually using surgery to pull folds, smooth out wrinkles, whereas fillers are used to fill areas where volume has been lost. It's common that as we age, our lips become thinner. So that will be a solution. The solution will be a volume replacement. Or you may have bags under the eye that tends to cast shadow. Volume replacement may be a solution. And one area that we really like using volume to replace that surgery really doesn't do a good job are in the cheek areas. If you have a flat cheek and you put volume back, it really gives the youthful look. It glows, it reflects light, it makes you look like you're cheerful all the time. If you use surgery to try to simulate, replace an area where you've lost volume, it gives you the overpulled look and doesn't look natural. So sometimes we will combine volume replacement in areas where volume is lost and surgery to pull areas that really require smoothing out with folds. First, you have to meet the person who is going to do the injection, let them study your face and understand what you're looking for, and then they select the right injectable filler. In addition, if you are on any blood thinners that will make you prone to bruising or bleeding, you may want to stay off it for a few weeks before the injection. There are some homeopathic agents that we think helps with swelling and bruising. A common one is actually pineapple extract. So I tell people, if you like pineapple, eat them before you come. But you can get from health food stores products like bromelain, which is a pineapple extract, or aneca, which is also known to minimize bruising. So these are the things that we would advise patients to use before they get an injectable filler, mainly to reduce bruising and swelling. We always say no pain, no gain. They can be painful, but they are not extremely painful. There are things that we do to make the procedure very comfortable. First, we can use topical agents. We have topical anesthetics. You come in maybe 20 minutes ahead of the procedure and you have a cream put on your skin that helps to numb the areas up. There are certain areas that are very sensitive. The lip is one of them. So sometimes you may do a block. An injection, just like going to a dentist, so the place goes numb before you do the injection. The manufacturers of the fillers that we use these days have been very responsive to patients' needs. Most of the fillers we use these days actually have an anesthetic agent added to it. So after the first few injections, the area goes numb and the pain is really not significant. We tend to also use very tiny needles, very small needles to minimize the pain. So this is a very good, important question that we tend to hear. How much of an injection should I use? How many times do I have to do it? And everybody is different, so you have to individualize the care. The one thing that is an advantage of using injectable fillers is that you see the results right away. So an area is treated, you look at it, you're happy with it, then you quit. You can come back when the swelling is gone, and if it needs a touch-up, you do it. Some people tend to go overboard. They want their lips plumped up, not shaped, and then in the end, it looks funny. You want to restore volume and make it look natural, and that's the one advantage that fillers have, maybe perhaps to surgery. Things can be done in increments. So whereas one person may need 5 mLs of a volume given to a particular area, another person may need less. In some people, they just want to gradually increase their look. They don't want a dramatic change right away. So you do a little bit, understanding that over time you can add till you get to your the effect that you want. And that's really one of the advantages of using an injectable filler. I've been asked this question so many times: how long does an injectable filler last? And most people would say, give me something that lasts forever. That's so I don't have to do this again. There are advantages for fillers that last a long time, and actually major disadvantages to that. For example, if a filler that was done in 2014 was the best thing ever, and you have it and it's going to stick around for 10 years, in 2016, when the next best thing comes, you are at a loss. We can't take the filler out. So we pick a filler based on the effect we want and how long we want. There are some that will be for 3 months, others that will last even up to 2 years, perhaps longer. If I am trying a filler in an area and you're not too sure whether you're going to like the result, it's better to pick one that is short lasting. And if you find out that I really like this result, the next time we can take something that is longer. So in general, you should expect that fillers will last anywhere from 3 months to a year. Some people will tell you this filler lasts 5 years. It may be what they saw when the products were being tested in the lab environment, but in real day-to-day, you're moving your face, using the filler, talking, it doesn't tend to last that long. So you always have to budget 3 months to a year, sometimes a little bit longer. I've never had a problem finding fat to inject to plumb the face. It's like you can rub the belly or rub the thigh, you pick your poison. We tend to pick fat from the areas that are individuals have more difficult losing. So for men, it tends to be the belly area. For females, it tends to be the thigh. So you liposuction the fat, and usually you take more than you think you need, and you process and purify it before you inject it to whichever targeted area it is. One person may pick one site over the other because they want the secondary gain. So maybe your inner arms are a little bit full. Instead of me liposuctioning your flat belly, you may choose to have me take the fat from the arm. But usually we can't find them. In general, injectable fillers are safe. The common side effects are the immediate post-procedure changes that you see: swelling, bruising, and that is sort of expected with the procedure. So you do things to minimize them. For example, having your head elevated the first few days, using ice to minimize the bruising, using some of the homeopathic agents that we talked about. But swelling, bruising are the most common side effects. Now, there are side effects that are maybe technique dependent, overdoing it, overfilling, so it looks awkward. Infections, those are uncommon, but those are usually treatable. The biggest concern is having the wrong filler injected into the wrong area. What do I mean by that? We will have people who would go on the internet and they've had something injected once or twice, they're happy with it, and they want to find a cheaper alternative. The cheaper is not necessarily all better, because if you get a complication from a filler injection, it is a major deal. And some people have lost their lives doing that. So if I'm injecting something on my face, I want someone who understands the anatomy and the workings of the face. So the common way to find the right person is usually by word of mouth. If you have a friend, a colleague who's had it done, that is usually a reliable area of way to find someone who is competent in doing it. Otherwise, plastic surgeons who focus on the face are usually very well trained in the area. There are some dermatologists who are also well trained in doing injectable fillers. But you do want someone who understands the anatomy and workings of the face.